Hello, and thanks for tuning into this part of our video series titled Under Pressure, a focus series on hypertension. I'm going to briefly talk with you about the complications of hypertension, both acute and chronic. Hypertension takes a toll on every organ system in the body, and complications can present either secondary to acute hypertension or to long-standing chronic hypertension. If we look at the effects of acute hypertension, such as what we would see with hypertensive emergency, the cardiovascular system, central nervous system, kidneys, and eyes are all target organs that can be damaged, causing any number of complications from aortic dissection to renal failure to stroke. Although some of the deleterious effects of acute hypertension may be reversible or self-limiting, this isn't always the case. For more information on hypertensive emergencies, I encourage you to watch our video on management of hypertensive crises. Chronic complications of hypertension truly cannot be underemphasized. Hypertension remains the leading cause of stroke, is the second leading cause of renal failure, and patients with hypertension have a 50% greater risk of ischemic heart disease. In addition, for every 20 millimeters of mercury increase in systolic blood pressure, there's a twofold greater risk of cardiovascular disease. Patients with hypertension also have up to a threefold increase in their risk of heart failure. In essence, the bottom line is that hypertension is the most important modifiable risk factor for preventing premature death. Hypertension is also associated with atrial fibrillation, peripheral artery disease, sexual dysfunction, and cognitive impairment. Thank you for viewing this video of the Under Pressure series on acute and chronic complications of hypertension.